St. Vincent's Hospital is one of Sydney, Australia's most reputable and well-known hospitals. It was founded in 1857 by the Sisters of Charity, who arrived to give care to Australia's leading private hospitals. It is also Australia's largest non-for-profit healthcare provider. One characteristic that makes St. Vincent's unique is its dual nature, consisting of both a public and a private sector. In Australia, there is the option to have public or private health care. It is important to understand the differences between the two. Each citizen has the right to Medicare under the National Health Care Act of 1953, which is funded by the government. It is free until somebody hits a certain salary. On the other hand, the private sector is driven by private health care funds such as MLP and BUPA. The Medicare levy surcharge of 1984 gives an extra 1.5% or greater tax towards Medicare, so that these high salary earners will be more likely to purchase private insurance, decreasing demand for public Medicare. To many Australians, it is not the small tax surcharge that necessarily convinces them to purchase insurance, but rather it is the superiority of the quality of healthcare services that they receive by switching. Private insurance means shorter waiting times for care and a larger pool of doctors to choose from. A procedure, such as a surgery, can take almost a year to be scheduled with public health care. Some might also say that the service quality in private sector is more reliable. Many Australians use a combination of both Medicare and private insurance to cover all of their medical needs. St. Vincent's Hospital consists of 6 public hospitals and 8 private hospitals throughout Australia. There is a disparity in service quality as a result of the huge difference in medical funding. 55% of St. Vincent's capital expenditure is accounted for by its private sector and 45% by its public sector. 90% of revenue in hospitals, public and private combined, come from accommodation and theater charges, while 10% comes from intensive care. Thus, the service environment and its tangibles weigh heavily on the patient's experience and their perception of the received service. From looking at both sections of the hospital, it is not hard to tell which is private and which is public. St. Vincent's Private Hospital has more impressive building and facilities, while the private sector is also adding more rooms to accommodate more people. The public hospital is still a high quality facility with more rooms than the private sector to fill the huge demand. It holds 43,000 patients versus the private sector, which only holds 23,000. St. Vincent's targets a wide variety of patients. The private sector mainly targets higher income individuals and those who need treatments that are not covered by healthcare. It also targets patients who require more intensive urgent care and who require super specialized procedures. On the other hand, the public sector targets the majority of Australians. Most people who have Medicare are single people who make less than $88,000 a year or families that make under $180,000 a year. The core benefit for the hospital's patients is to receive medical care. The staff in both sectors of SVHA work together to accomplish one goal: to provide the highest possible customer service to his patients. There is also a strong religious element embedded throughout St. Vincent's. In their eyes, everyone was created equally by God and therefore should receive equal treatment. The hospital's creed is to bring God's love to those in need through the ministry of Jesus.
Thank you, Lindsay. While the quality of services between the public and private sectors at St. Vincent's are quite different, the core benefit of the hospital is really the same throughout. So, St. Vincent's core benefit to its patients is high quality treatment. It's driven by their overall vision to lead through research driven and compassionate care. Their core benefit is also driven by 4 core values that they emphasize on their website: compassion, justice, integrity, and excellence. So what are the elements that support their core benefit of treating patients? Well, first, they emphasize providing a holistic approach that is centered on the needs of each patient. So that while St. Vincent's wants to make sure that each and every one of its patients receives the same standard of consistent high-quality care, it also wants to make sure that their treatment is patient-centric, meaning it can adapt to each patient's wants and needs. Secondly, the hospital really focuses on quality improvement, striving to make their treatment as effective and safe as possible. The hospital is continuously improving their methods of care and taking new approaches to treatment to meet the changing needs of patients. It can best adjust to patients' needs by continuous feedback, and this happens through biannual surveys. The hospital also makes sure that its doctors, nurses, and surgeons are equipped with the right training and tools to succeed. It also really makes sure that its staff is dedicated to their work and really engaged with their patients. St. Vincent's also does everything in its power to make sure that its staff is appropriately qualified and that its staff members' values fall in line with St. Vincent's. So it not only wants to make sure that its doctors and nurses are prepared to take on patients and qualified, but that they're a good fit and have the same values as St. Vincent's. Lastly, the hospital makes sure that in the face of a constantly changing healthcare environment, that they uphold the traditional values that they have stood by from the get-go. When you walk through St. Vincent's Hospital, both public and private wards, you'll notice a theme of religious values. There are plenty of portraits of Mary Aikenhead and the Sisters of Charity. These portraits also, they play a very important role in the patient's overall perception of the hospital and the overall service-scape, reminding each patient that walks in of the hospital's core values. I want to mention that the core benefits of the two sectors, while they're mostly consistent, they vary slightly as the public sector acts more of a nonprofit, fulfilling the hospital's mission to help the poor and most vulnerable Australians. A lot of them seeking asylum. A lot of them have mental illness and addiction. And then on the other hand, the private health sector obviously has a larger pool of resources to work with and significantly higher margins. So they run more like businesses and less like nonprofits. So they're more positioned to compete. So a lot of the competition that comes from St. Vincent's in the marketplace really comes from the private sector. So how does St. Vincent's stand in relation to other hospitals in Sydney? Well, first, a little bit about the hospital service industry in Australia as a whole. As in most developed countries, Australia's growing population is driving demand in both private and public sectors. With more elderly people, there's a growing incidence of chronic illness. So the healthcare industry is very much growing, and there's a lot of room for competition in the marketplace. In this constantly changing healthcare service marketplace, St. Vincent's is positioned to succeed, and this is because of several factors. The most important being, one, it has a highly skilled workforce and a great training program in place. Two, it really seems to have a grasp of government policies and is able to work with them. Three, it continues to have a range of accessible options available to both high-income earners and poor Sydney-siders. This is because it has a public and private sector. So its dual nature allows it to have a lot broader of a target market than sole private or public hospitals. So this really serves to their advantage. Four, they make their information available to patients so that they can make well-informed choices about their treatment. So there's a lot of transparency here. It's clear, though, from my research that St. Vincent's greatest leverage is that because it's both public and private, it reaps the benefits of government funding as well as being able to afford high-quality technology and compete in the marketplace. And because the private and public sectors are co-located, doctors from each hospital can share a pool of resources in a more efficient manner than if they were located in different parts of the city. One source of criticism about the competitive environment in Australia, and I'll close with this, is that while the competition on quality can lead to better health outcomes, it can also raise the cost of treatment substantially. So St. Vincent's actually stands out and capitalizes on this criticism because it offers highest quality treatment for its patients who are willing to pay a premium, but also high quality standard care for the poor. So its negative association with in the public eye with high cost of care and the private sector is offset by their services offered in the public sector.
Thank you so much, Janine. We had a great time this semester and learned a lot.